Second.
Come on.
The sharing platform. Can you elaborate more on what kind of...
His decision to reconvene the committee is based mainly on the evidence of increasing numbers of cases, on evidence for human-to-human transmission that has occurred outside of China. These developments in terms of the evolution of the outbreak and the further development of transmission is of great concern and has spurred countries into action, and we're very grateful for that action, especially in China. What we know at this stage, this is still obviously a very active outbreak, and information is being updated and changing by the hour. It is clearly still centred in China, with the overwhelming majority of cases still being reported from China. However, there are 71 cases reported in 15 other countries. Of note within those cases is the majority of those cases, apart from 6, are associated with travel to China, and of those, the vast majority of those cases are associated still with travel to Wuhan.
Good afternoon, everyone. Thank you very much
The disease is obviously a mainly respiratory disease, passing via droplets from one person to the other, and mostly still through close contact. The source, as we've said before, is still unclear, and investigations continue in that regard.
Today, the press conference.
The challenge is great, but the response has been massive, and the Chinese government deserve huge credit for that response and for the transparency in which they have dealt with this. A case in point, in terms of one of the clusters of infection that we're currently working with Germany to investigate, it was the lab in China who contacted Germany to tell them that they had a return case who was positive. So China is not only helping to manage the cases in its own country, but it is actively reaching out on an individual basis, not only to WHO, but to other partners in the world, to help them respond in a more effective way. As I said, they are taking extraordinary measures in the face of what is an extraordinary challenge.
Regarding the situation, we do know that coronavirus.
We're very grateful that China will invite a team to help work with them side by side to learn more about this disease and learn more about how China is taking action.
We know many of you here in the room. We are at the UN building in Geneva.
But the whole world needs to be on alert now. The whole world needs to take action and be ready for any cases that come, either from the original epicenter or from other epicenters that become established.
WHO said it's going to set up a novel coronaviruses data.
I was involved in 2002 and 3 in SARS, and I can tell you from direct operational experience that there is no comparison between the behaviour of China then and the behaviour of China now. Countries are always sensitive, and I would point you to any of the other surrounding countries that have imported cases, including some very large ones. They're always sensitive about sharing information about new diseases. And in fact, some countries have laws that don't allow them to do that because there are issues around the national security. So I think before we start pointing the finger at China, we also need to recognise that there are genuine sensitivities around sharing data around new diseases, and I believe in this case the countries that have been affected, including China, have been remarkably transparent in this regard.
To consider this a global health emergency, how will this advance the operation in terms of trying to tackle this